webinar series on autism spectrum disorder. So thank you so very much for joining us over the past 5 weeks. I hope this has been a beneficial learning experience for you all. Thank you as well for all of the feedback that you've shared with us over the past 4 to 5 weeks. So today, as I mentioned, this is the final part of this webinar series, and today the focus is on patient and family experience. Before we start today's webinar, again, this is the review of the 5 webinars that we've held for you today, and today is the final part. And we are inviting our speakers from the Child Development Center here in Qatar and from Hamad Medical Corporation. So big thanks to our speakers today for giving up their time and sharing their insights. As always, we try to make this an interactive webinar, so please use the chat to jot down your questions and your comments. Please, I request that you avoid too many comments in the chat that are irrelevant. It's nice to say hello and good afternoon, but this does take up space and it's difficult for us to find the relevant questions. So please reserve the chat for relevant questions and comments related to the learning content. Thank you very much. So before we start today's webinar, I'd like just to provide this disclaimer that the presenting authors and scientific planning committee have no relationships and no conflict of interest to disclose. And the webinar learning outcomes for today, we want to discuss strategies of providing empathetic, neurodiversity affirming, person-centered care to people with ASD. Secondly, to describe the strategies to building and strengthening family support systems. Thirdly, to discuss challenges and solutions to creating ASD stigma-free culture. And finally, to distinguish between positive and stigmatizing language used in the context of ASD. Regarding your CPD points, so we shared with you the post-activity evaluation. You should have received that by email. We'll also be sharing it with you at the end of the webinar. So this link becomes active at the end of the webinar, and it will stay active for 60 minutes. So please take the time to complete the survey before 2 p.m. today, after which the survey will be deactivated. I'd also like just to take this opportunity to thank our moderator today, Dr. Shahed, who will be taking your questions and putting your questions to the speakers of today's webinar. So without further ado, I'd like to hand over to Dr. Shahed, who will be introducing today's speakers. Thank you.
Thank you so much, Dr. Zakaria. Honestly, I cannot believe that we've reached the final part of this very important and very impactful, inshallah, series. And I'm so happy that we have chosen and we get to end it on this note on patient and family experience. I think this is one of the key things that we've mentioned throughout the series, that our role as healthcare providers in impacting and innovating and enhancing patient care for people who have ASD, it really extends beyond just providing treatment specifically for ASD. And this is such a good reminder that wherever you work, whatever you do, whatever is your profession, inshallah, you can find benefit in these sessions and help the community of healthcare and Qatar in general become a better community for individuals with autism. Today we have our selection of speakers from HMC and CDC, just as Dr. Zakaria mentioned. And inshallah, our first panelist will be Ms. Rama Deep. Ms. Rama Deep is a speech language pathologist with over 8 years of experience working with individuals on autism spectrum. Ms. Rama earned her master's degree from the Damascus University in 2016 and has been supporting communication and language development for autistic individuals ever since. She currently continues this important work as part of the team at Hamad Medical Corporation, which she joined in 2022. Ms. Rama, you may share your screen and start your presentation.
Okay. Hello, everyone. Hello, everyone. I would like to thank you all for being here today to learn more about the autism and and for showing your support to autism communicate. As for my part today, I in this presentation I will talk about the strategies of providing empathic, neurodiversity affirming approach, person-centered care to people with ASD. Okay, for my agenda today, I will speak about empathic, building a bridge of empathy, power of empathy, neurodiversity affirming core principle, benefit of person-centered care, empowering autistic individuals, person-centered care strategies, and benefit of person-centered care. According to American Theatric Association, ASD is a neurodevelopmental disorder marked by difference in social communication and the presence of restricted and repetitive pattern of behavior and interesting. So when we Okay. When the ASD child receive a care that is empathic and neurodiversity affirming and person-centered care, they feel more or better understood and supported, which lead to increase well-being and quality of life. For the first title, empathic. What is the empathy? Empathic is the ability to sense other people' emotion, coupled with the ability to imagine what someone else might be thinking or feeling. There are three kind or forms for the empathy, cognitive empathy, like it mean understanding another person thought and feeling. The second type, emotional empathy, sharing the emotion with the other another person. Compassionate empathy, like take action for someone or so to help someone in need. For empathic also, for ASD child has some challenge or some experience empathy differently. Today we will talk about some strategic we can use it to make a positive connecting with people with the ASD. We start with the first strategy. It talk about effective communication. Effective communication, it's a foundation of empathy. When interacting with the ASD child, we should use a simple language or a clear language. We should avoid the joking. Also, we should check the understanding by using open and ended the question when interact with them. And also, you should be patient because, as we know, many of autism child need more time to process the information. Process the information and response to our communication. So also to achieve this effective communication, we should use the visual aids and writing instruction when we communicating with autistic child. Also, we should all of therapists or all of people who interacting with autistic child should has a sensory awareness, like because the sensory awareness, it's a powerful tools to building the empathy. So by creating a sensory friendly environment and offer breaks for if we treat the autistic child in a environment. So also we should sometimes to provide them individual toys to help them to manage the sensory overload. Also for the, we have here some strategic like understanding needs and preference. It could, this strategy, it could be the, sorry. Yeah, can you open it? Okay. And this strategy can be first. I'm sorry, just I want to like, okay. Okay, this strategy can be first strategy to building the empathy by if we know and understand the unique needs for the autistic child and know the sensory profile for them, or what are the communication style and what are preference. Now after when we take the a good answer or know this answer this question, we can build the trust and connection with them by and connection and make a positive connection with them. And so we should be active listening and try to listen what the autistic child try to say, both verbal or non-verbal. Also, we should be patient with a communication styles because some children try to communication by a gesture, some children try to communication by a single word. So we should respect all the communication styles for them. The power of empathy, for this approach is strong relationship with autistic individual, improved communication and collaboration, a more inclusive and supportive community. Okay. For the next second approach is a neurodiversity affirming. This approach was created by Judy Singer in 1990. This approach is a concept where neurologic difference to be recognized and respect as any other human variation. This in this approach, they divided or broken down into two subgroup of individual, like neurotypical. Neurotypical refers to some people or to people who think and to process information in a way typical in their culture. The second type of it's neurodivergent. Neurodivergent, it is referred to individual with whose brain functioning differ from what is the considered typical. This approach say that it's a natural variation. This approach try or emphasize to not to emphasize to use or to identify the first language, like seeing autistic child, not use مثلا like example the children who has autistic or low function children or high function children. So he embracing to identify first language and use the autistic child. Also, this approach sees ASD or autistic child is a natural variation in a human brain functional. For a strategy, this approach use many a core principle or many strategic to use it when we interacting as a therapist with the people or autistic child. The first one, respect for neurodiversity. Like we should, as I mentioned before, we should respect the different. We should respect the different for this child. And for the second strategy, individualized support, it involves to work with it in sorry it okay by we can support this individualized by creating environment systems and practices ensuring the autistic child can be full participation in society and education and employment. Strengths-based approach. This approach focusing in strength and preferring rather than their challenge, and inclusivity and accessibility. And this strategy this strategy involves to working closely with the neurodivergent and family educator and other professional. Fourth, social relation model of disability. This model try to change the environment by creating accessible spaces and sensory consideration and improve the communication practices. Also, this approach emphasizes collaboration partnership between the individual and the families and the professionals, holistic well-being by emphasizing the support holistic well-being for the autistic individual, including their mental, physical, and social health. Also, additionally, the other strategic use we can use it in this approach is lifelong learning and growth. Recognizing the learning and growth is a continuous process for all the people, including the autistic child. Also, for challenging stigma and stereotypes, actively working to challenge and change the social stereotype, stigma, and misconception. For the last strategic in this approach, culture competency. In culture competency, we should recognize and respecting the autistic or a diverse culture, linguistic, and personal backgrounds. Okay, now I will talk about the last or third approach, person-centered care. Person-centered care is a collaborative approach to the planning, delivery, and evaluation of a clinical service. It is grounded in the mutually beneficial partnership among individual service families. For the person-centered care, it's not just approach; it's a philosophy that guide our decision and our interaction. By focusing in the quality, compassion, and partnership, we can create a supportive environment where the person with the ASD can thrive. Yeah, and in this approach also there's many strategies we should use it when we treat or interaction with the autistic child. In the first one, to speak about the individualized assessment. So we need to identify the style communication for this child. We need to know the sensory profile for this child. Also, we need to determine the unique needs. And then after this assessment, we can establish a achievable goal that is suits with the person value. Also, when establish this goal, or when we setting this goal, these goals should be a flexible and adaptive intervention. And when we start this intervention, we should use, as I mentioned before, we should use the effect communication in our treatment or our interacting. Also, during our treatment, we should supporting independence during the daily activity and life skills. Also, in this approach, we need to collaborative a family partnership by engage the family in our treatment or in care process. Like, we can provide the support, we can provide the research, also we can provide the training for this family. Okay, the last and in the end, there's some benefit for when we use the person-centered care with the autistic child. Like, we can take a better culture, better care, and better health. Finish. Thank you for your listening.
Thank you so much, Ms. Rama, for this comprehensive presentation. I really loved what you said about how it's important to provide accessible environment in healthcare to individuals with ASD. Perhaps this is something that you can elaborate on. We've received so many questions about how to, for example, adapt our clinics, our hospitals, to make them more accessible to autistic individuals. Can you give any advice on that?
Yes, as I mentioned before, when we interacted or when we try to adapt this our environment, we should use a clear communication with them. We should use a simple language. We should avoid the jargon. Also, we should need be patient when we communication with them. We need to give him some time or to process the information. Also, we can reduce the sensory input, because as we know, many of autistic child has sensory issues, like sometimes like light, bright lights, strong smell. So we need to respect or to respect their space. And some of autistic child that avoid forceful touch.
Mhm. Okay.
And
This
also,
actually.
and also for the communication, we need to support all the way they communication with us. Like, as I mentioned, that maybe they will use a gesture, maybe they would use a single word, because sometimes some
Mhm.
parents must try to let the child speak. No, say water. Maybe he make a point for water, and the family,
Mhm.
no, you should say water to give to you. So no,
Yeah.
we should immediately response his communication.
Thank you so much. Perhaps very briefly, any strategies regarding dealing with different communication styles, other than like understanding those communication styles and respecting them? Anything that you can advise healthcare providers to do when working with people with, as you said, dealing with gestures, for example, rather than speaking?
Yes, for a different communication, this a child, maybe the verbal or non-verbal child has a problem, or they cannot, if this child has some language or some language skill, they face a problem to make to use this language functionally. So we can use the AAC devices or AAC approach with them to enhance their communication.
Thank you so much. We wish we have so much time to like deep dive into this. Inshallah, maybe at the end of the session, we can speak more about this approach you just mentioned.
Yeah.
Next, we have Miss Rana Ajouli, an occupational therapist. Ms.
Yes.
Rana has joined Hamad Medical Corporation last year in 2023, and after graduating from Jordan's Hashemite University in 2014, she has spent nearly a decade providing support and occupational therapy services to individuals with various conditions, including autism. Please welcome Ms. Rana.
Hello, everybody. Hi. I would firstly express my gratitude for participating in such an incredible event. And it's been nice here. I hope now I'll be able to provide what will be like most clear and most important for us as healthcare providers and for others who are families for kids with autism. Just give me please a little bit. So now I'll start sharing my presentation. So now I'll be talking about strategies for building and strengthening a family support system for kids with autism.
We can't hear you. Maybe try to mute and unmute.
I think while we're trying to correct those issues, we'll take some questions that have come in from the audience. I know we have Ms. Camilla as well. You're with us, and maybe you can contribute towards these discussions as well. So one of the first questions that we've received is regarding any changes or efforts that can be done on a team or organization level that can help provide a more neurodiversity affirming healthcare environment. So, Ms. Camilla, would you mind to answer that question, please?
Yes, thank you, Dr. Zakaria. Certainly within our organizations, be it centers, schools, workplaces, museums, malls, hotels, the very first step really is to do trainings for people on autism, like what autism is. And in my section of the presentation, I'll be talking a little bit about the importance of spreading awareness and the fact that autism is not understood well by general public and different places. And without first sort of looking at understanding what autism truly is, you cannot really move towards a neuro-affirming approach. So this would be the first step. And the second step also is to, which I will touch on in my section of the presentation, is to move away from a very medicalized view of autism, okay, to sort of deviate from impairment-based approach, to stop looking at autism as a disorder, disease, as if there was something wrong with individuals with autism, which is a very old-fashioned and outdated approach, and moving towards more social and biopsychosocial approach, looking at autism as a form of diversity. We're all different. Our brains work differently. We're all neurodiverse. And this is how autism is now conceptualized in the context of the neurodiversity approach.
That's really interesting. Can I, while we resolve the issues with the other presentation, can I ask you to begin your presentation, please, and then maybe to elaborate on some of those points a little bit more?
Yes. Okay. Can you hear me?
Yeah.
Yes, perfect. Now, I'm going to touch on stigma and creating stigma-free culture. And I'm going to also talk about language and the importance of language in the context of autism. Now, what is stigma? Well, stigma occurs when a person who is perceived to possess a particular attribute, which is essentially culturally understood as devalued or discrediting in some way. It involves recognition of the difference of devaluation, and therefore a person who has those discrediting attributes in some way deviates from the society's perception of what is perceived culturally and socially as normal, right? And this results in a sort of widespread social disapproval. It's that concept of them and us, right? Now, so where does stigma come from? Now, stigma and the understanding of autism, we need to understand that the understanding of autism as a medical disorder, especially causes of autism, have been evolving tremendously since autism was first described. And this has really impacted on the perceptions of autism in the community, as well as mothers of children with autism, and not just in the Western context where autism was first described, but internationally across different cultures. Now, autism was first described and defined in 1943 by Leo Kanner, and Leo Kanner he was a doctor. He looked at autism as a combination of genetic predispositions and mothering styles. That's how autism was first perceived, right? Now, after that, in the 1950s and 1960s, the psychoanalytic thought that dominated the discourse in the US, and particularly psychiatry field, as well as the work of Bruno Bettelheim, who in the 1960s has led to this concept of very damaging concept of looking at autism being caused by cold and unloving mothers. Now, it was linked to the mothering style. Now, this was 1950s, 1960s in the US. Now, this has, as you can imagine, created a very damaging perceptions of autism and mothers. It was perceived as a disorder, and as a disorder that has been essentially attributed to cold and unloving mothering. Now, over the years, so this is going back 60 years essentially, over the past 50, 60 years, empirical evidence and studies have shown that this is not true. Okay, now we have recognized, and science has recognized, the cognitive and the biological genetic factors associated with autism. It has been proven that autism has absolutely nothing to do with parents, with mothering, and with any sort of parenting style. And this has led to those negative connotations associated with autism to be proven incorrect, which has changed a lot in the context of stigma, because you can imagine how stigmatized parents of children with autism would have been back in the 60s and 70s. And this is where the concept of the refrigerator mother comes from. And this book that I'm referencing here in the slide, Donovan and Zucker, its title in a different key. This is one of the best books that I can recommend to those of you who are interested in autism and the evolution of autism, and as a disorder and a socially constructed concept as a label in our history. A very, very good book, highly recommended. Now, why culture needs to be looked at when we are talking about autism? Well, social and cultural factors are very likely to be at play when we are trying to understand autism. And the work by Grinker, I would like to highlight here. He has done a lot of work across different cultures, particularly Korea, which is a non-Western culture. And over the centuries, he has noted that the medical discovery was essentially the driving force in the inception and evolving of our understanding of autism and categories and connotations of health and illness and essentially the body across the globe. And he said, yes, that is right. However, it was not just that. More importantly, it was the culture and the social and historical factors that were important in the context of understanding autism. And science is essentially a culturally and historically constituted system of beliefs and knowledge. And different times and different places, different cultural contexts will produce different classification systems. So what autism may mean in one place or in one culture can be very, very different to what it means or what it is to be understood in another culture or another place around the world. For example, I would like to give you an example with respect to social skill delays that are linked to autism. Eye contact, right? So in the previous sessions, you would have learned that poor eye contact, this is essentially establishing and maintaining eye contact, can be associated with autism. And now, with respect to eye contact, there are significant differences between the Western culture and Asian culture, for example. So what can be perceived as poor eye contact in the Western culture may not necessarily be the case in the Asian culture. And this can, for example, delay early recognition of autism as a symptom or the characteristic of autism, for example, in the Asian culture. So this is one of the examples. Now, with respect to autism particularly, so why stigma is so unique in autism? Well, for a couple of reasons, right? Now, the work of Gray is particularly important here, and Gray emphasized that autism has very uniquely stigmatizing aspects because of one, extremely disruptive nature of the autistic symptoms, and two, sort of normal physical appearance of children with autism. And what that means is that there are no physical characteristics. So people and public cannot really say or cannot tell that a child does have autism by just looking at the child. And the combination of these make autism and stigma in autism particularly unique and different from any other disorder or disability. And socially inappropriate disruptive behaviors, which are often associated with symptoms of autism, for example, self-injury, aggression, meltdowns, or tantrums, can be perceived very negatively in our and any society, in fact. And this can be further reinforced by the invisibility of autism with respect to the lack of physical characteristics, which would be indicative of a disability. And this can prevent people in public from essentially recognizing that a child has autism. Now, in terms of the solutions then, so what are the solutions to creating a stigma-free environment? Well, and culture. Well, the first thing really is understanding autism and spreading awareness. And this course, this CPD that we are currently delivering, this is a very, very important step in helping people understand autism and its causes. Now, educating others is critical because this can lead to increased awareness, understanding, and awareness and understanding is critical for increased acceptance. We will not have acceptance of autism in our society, in our culture, if we are not aware and if we do not understand what autism is. Now, I mentioned earlier, very, very important point about the models of disability. It is critical that we do adapt a social and biopsychosocial model of disability and move away from this medicalized impairment-based model of autism. Now, with respect to the neurodiversity, which is something that the previous speaker has mentioned, this is also very, very important to make sure that we kind of implement and look at neurodiverse approach to intervention rather than impairment based approach, where the goal of that is really to fix certain things, and that is critical. Now, with respect to language, now we need to distinguish between positive and appropriate and stigmatizing language used in the context of autism. Now, language impacts on how autism as a medical disorder, as a socially constructed label, is understood in the society. Now, over the past 3 decades, essentially, we have seen a major shift in our understanding of the strong links between autism and identity. Okay, now these developments have essentially called for careful consideration of language that is used by professionals and by the public, essentially, to describe autism. Now, the term autism, as I mentioned earlier, emerged in early 20th century, and subsequently in the 1940s, the term was first used to represent children with certain behavioral characteristics, but that has been changing. And then after initially being included in the DSM-3 in the 1980, so that's the time where autism was included in the DSM for the very first time. It was the DSM, the 3rd edition of the DSM, and since then, you know, clinicians essentially have been trying to sort of adapt the medical model and look at abnormal and atypical features, trying to fix them. Now, since then, a lot has changed. And essentially, autism over the years, as it has evolved and it has become more recognized with respect to the genetic factors and also the neurological difference, rather than a disorder per se, clinical and research efforts have been encouraged to focus on creating more inclusive environments, societies, and also to enhance that language. Now, the evolution in terms of understanding of autism has also mirrored the transition of the use of language, and essentially, as I mean, language continuously evolves. So this is sort of where we're at now with respect to language. And this is not to say that this will not change, because over the past 30, 40 years, there has been a lot of changes. So terms that would have been used 20 or 30 years ago in literature, for example, are no longer used now. And this continuously evolves. And you know, many of the potentially offensive and inappropriate terms that I have included in this table, and I have another slide demonstrating some of the other terms, they show how a medical and deficit-focused view of disability is now not, and autism is not appropriate now. And these terms show you how something that is wrong with children or individuals with autism and something that needs to be fixed or cured, or that individuals with autism are in any way inferior or in some way to non-autistic individuals, that all of these things are not what we want or how we should be conceptualizing autism. And now with in line with the neurodiversity movement and neurodiverse approach, we are looking at a completely different approach. So what we're talking about is autism and autistic. We're looking at the use of identity first language, and this is particularly important. What identity first language means is essentially that we are looking at the person first. Yeah, so we are looking at that identity. We are looking at autism as being part of their identity rather than this disorder that is something that you do not want to have. And this is particularly relevant for individuals with Asperger's, for example. And Asperger's, it used to be understood as sort of a high functioning autism. And now in the latest edition of the DSM-5, Asperger's was completely removed from the diagnostic criteria. Now, as you can imagine, people who used to perceive themselves as being Aspies, this is how people with Asperger's syndrome used to refer to themselves. This was part of their identity. Now, then when Asperger's was removed and it was replaced with autism, essentially autism spectrum disorder, as a high functioning autism spectrum disorder. Now this has impacted on individuals with Asperger's, because suddenly Asperger's didn't exist, but it was part of their identity. So this is an important point to consider. A couple of more examples before we wrap up. Comorbid, this is a term that is used in the medical field, but we would sort of talk about co-occurring these days. Now, in terms of functioning, in the past, there was a lot of emphasis on low functioning and high functioning autism. And now you can imagine how, for example, being a parent, you're coming into, an assessment, and then a clinician says, well, your child is low functioning. And then there's another parent whose child is high functioning, or mild autism and severe autism. Like these labels, you can see how stigmatizing these labels could be. So now we talk about levels of support, and the newest DSM-5 also calls for the use of levels, level 1, 2, and 3. When you're talking about severity, not low, mild, moderate, or severe, we're also talking about specific support needs. Again, just one last point, we're not talking about cure, we're not talking about treatment, or we're not talking about individuals with autism deviating from a normal perception of whatever normality is. The word normal should not even be used in this context. So I will leave these examples here in the slides so you can go through all of them at your own time. A couple of references. I would like to draw your attention to the second reference, Donovan and Zucker, In a Different Key, The Story of Autism. This is an incredible book. You would absolutely love it. I can highly recommend this. And you have the other references here as well if you want to follow up on those. Thank you very much.
Thank you so much, Ms. Kamila Janik, Director of the Child Development Center for Special Needs, board certified behavior analyst, feeding specialist, and an early intervention educational consultant. Ms. Kamila, I really loved what you said about how language is evolving, how it's really dynamic. It's not a set of rules, but rather it depends on the condition, it depends on the people, on the community. This is why, as you mentioned, there's this controversy of using identity first, so autistic person versus person first language, so person with autism. I would also like to point out how through research uh, we also saw that there might be a difference because of language as well. For example, here in Arab countries, identity first language, we would say mutawahed, which is highly stigmatized here in Qatar. So it's really important that we pay attention to that as well. Perhaps on that line, are there any specific misconceptions, stereotypes that you've noticed here in Qatar that you might want to advise healthcare providers to look out for, make sure that they avoid it, or like avoid using them?
Thank you, Dr. Shakt. I would say the use of the word normal. I absolutely hate that word. And I hear it, I mean, almost every day, especially when I have parents coming for initial consultations with children. And you know, that whole concept of if my child has autism, my child is not normal. Like, what is normal, really? That's the word normal sort of has connotations of this perfect development and perfect human, right? And then that connotation then linked with, well, autism spectrum disorder, and then parents would, you know, Google it and read about this. And autism is so, I mean, it's a spectrum. Every child with autism is very different. So the combination of autism being very, very different when it comes to different children. You know, you cannot really give one definition of what autism spectrum disorder is, and then you're linking that with the word normal, and my child is not normal, or certain behaviors are not normal, rather than looking at the behavior itself and kind of looking at how does it impact quality of life and what can be done to enhance the quality of life of individuals. I feel like this is one word that I would like to highlight. Yes.
Certainly, and I think one of the repercussions that we see resulting from such concepts, and it's something that we've talked about throughout the sessions, is masking and camouflaging. Can you perhaps talk a bit about that from your experience? What does this look like? How can we what can we do as healthcare providers to provide a more autism-friendly environment?
Yes, masking is we see a lot of masking, especially with not young children, because of course they're not aware of it yet. But as children grow up and as they become teenagers and they become more aware of the fact that perhaps certain behaviors that they engage in are different from the behaviors of, let's say, their peers in the class or other people in the community. So as children sort of start growing up, we see a lot more masking with teenagers and then adults. You know, over the last couple of years, we've all seen many adults sort of coming out and saying, I do have autism, or I've been diagnosed with autism as an adult, and realizing that they've been masking all their life, essentially. And what masking is basically trying to basically hide certain behaviors and basically try to comply with those perceptions of normality in our society. So you're, as an adult or as a teenager, you're aware that socially and culturally there are certain norms, right?
Yeah.
And if I deviate from the norm, well, I guess I need to mask, I need to hide certain behaviors that I do engage in order to basically show the community, show everybody in my life that I am normal and I do comply with those norms that are socially created, right? So this is
Yeah.
a big problem. Education for sure, and in our community particularly, we need to see more services and supports for teenagers and adults, because there we have a lot of centers, a lot of services for children, and it's almost like it's oversaturated with respect to early services for toddlers. But if you were to ask me what services are available in terms of psychological support, for example, in terms of family support, in terms of respite, in terms of vocational for 15, 16, 18-year-olds, 25-year-olds, very few. So this is where the field needs to, this is what the field needs to focus on in terms of service provision.
Yes,
Counseling
definitely.
services, for example, very
Yes.
important.
And we're very fortunate to be in a country where this government cares about autism, and there are so many services, but also there are so many opportunities for more services focusing on a wider population of autistic individuals. Can we actually, this ties really nicely to my next question. Can you perhaps speak a bit about what has been done at a national level, more specifically in relation to awareness and stigma? Anything that comes to mind?
Yes, so in 2017, Dr. Goldberg and her team came here to Qatar from the UK, from one of the British universities, and they conducted a large study on the sort of the provisions for children and adults with autism. And the study involved interviews with different stakeholders, including service providers, parents, focus groups. So we participated in one of the focus groups. And then as a result of that, Goldberg et al. 2017, you can access the report online, has highlighted several areas that need to be worked on. And they have highlighted all the good things that we have seen with respect to Qatar, and especially development of early intervention services. And then they've also highlighted the need for, vocational skills trainings and work opportunities and other areas. So now there's also the Qatar national plan that highlights focuses on disability and recognition of disability, which is another really important piece. And we are definitely moving closer to where we need to be. I mean, Doha is definitely not the same as it used to be even 9 years ago when I moved here, so I mean, 9 years ago, we wouldn't have this webinar, right? And now we are having it. And I mean, 9 years ago, no one was talking, even 5 years ago, no one was talking about neurodiversity. Like that word would not even be on the agenda. Whereas now, I mean, sometimes I have parents who come and, they ask, is the service neuro-affirming? Is the service person-centered? Which I can tell you right now that when I used to do consultations 8 or 9 years ago, no one would even bring up. So I see a huge shift, and there's a lot of attempts, at the national level and international with respect to that.
Thank you so much. Honestly, what you've said is really inspiring, and hopefully it pushes everyone here to all work together to bring basically that level to even like a higher and better level, inshallah.
Yes.
Yes. So we've not approached. We've reached the end of our time. I think we can take some more minutes to address some more questions. We actually have more questions, but I see Dr. Zakaria has brought up the evaluation QR code. This evaluation link has also been sent to your email, and it will be active for 60 minutes, right, Doctor? Yes. Today, as we said earlier, we also have with us Ms. Rana Julie, and we'd really love to hear your perspective about on strategies to building and strengthening family support systems. So, Ms. Rana, if you can briefly give us your best and biggest and most important tips on how to support family members of individuals with ASD.
Okay, so first of all, I would express my sorries for the technical issue. I'm really sorry. Regarding my topic, we've been talking about the how we can establish a family-centered care for kids with autism. So as a healthcare provider, for me as a therapist working with autistic kids, the first thing I face when I read interacting with the families who are facing the stigmas and the cultural shock, even the shock that their child is autistic, and he was got the definition of autistic, how he will grow up, how he will face his future, how he'll be able to depend on himself. So all of these, how we are as healthcare provider, how we'll be able to prepare the family to contain all of these fears and try to start providing our best to be able to provide the proper assistance, the proper guidance for their child. So first of all, we are making the assessment, we are trying to providing the most tips, recommendations, providing the insight for the current situation for their child. And for me, I prefer to start looking for the strengths of the child, because we are talking about varieties of personalities with the different of kids. So every child is different than the another. So your particular child is different than the other. So we are not generalizing. You have to see what's the main important for a child, what's he loves the most, what he's very much good at. So you start building. After that, when the parents understand all of these, they will be able to know from where they will start. When they are know we will start from here, okay, so I will work on the parents, on the family itself, because it's the first environment, starting and start collaboration with the child. We want this child to get out from his own circle, to extend his circle a little bit, let some members of the family to get in. So providing awareness, and just not providing the awareness, we want to be able to apply this awareness in all environments that the child can be in. Not only the family, will be extending a little bit nurseries, schools, centers, the other people who are seeing other kids, are they ready to apply this awareness? We all hear about autism, we all read about autism, but are really able to contain what the behaviors we might see from other kids, and are we going to give that look for this family who's having this autistic child facing this behavioral issue now? I think just till now, sometimes in some facilities, we are still not yet ready. So not only providing awareness, we have to be implementing the awareness. Sorry for that. Implementing and applying. After applying the awareness, how be able to participate as family members. Each one in the family has a role, and each one of us has to do his part to help his child to provide and improve and get out the best of him. The professional guidance from the therapist or the doctor or the psychiatric, provide the proper assistance for the families. They will help them to be and this is my path. I have to continue doing this. This is the strategies I have to start and continue building on. After that, like supporting groups for the families, that we are not alone, feeling like there is others like us sharing experience, sharing like how they are the strategies for coping sometimes. Like being in a group makes like to see it's easier for me. I am not here alone in this world. Like there are others, many maybe I have more difficult even cases than mine. So this will be feeling like I am here with someone shares me. You see, the not as Rama was talking about the empathy. They will feel what I feel. To see people can feel what I feel like means a lot for me, even for us as a human beings, not just for families of autistic kids. So it's very much important to guide the people to be able to join like such groups. Also, creating a structured routine for the child. For occupational therapists now, we are working on teaching the families because we are providing family-centered care services. So when we teach the family what to do exactly, how to make the structured routine according to child's needs and abilities, capabilities, age, and what's his role in now if he's going to university or he's attending school or he's just not going anywhere. So according to his like capabilities, we can make a scheduled routine. We'll start like for example with 5 cards. We are waking up, we're changing dressings, doing the self-hygiene, brushing our teeth. After that, we'll like having breakfast. Then we are going to the bar to prepare the child for what will happen for him during the day. This will make him like relieved that there is not unpredictable things will happen to me. And even for us, we are checking for ourselves as in if you just tell me what I will do during the day, it would be much better if you just give me like more sudden surprises, like chores and things to do. Encouraging the positive.
I think what you've said nicely summarizes a lot of the things that we've said throughout this session and all of the sessions, really. Providing a better healthcare system for autistic individuals, a better community that really appreciates difference, appreciates unique abilities. And that's why, as you said, it's important to take an approach that focuses on strength, right? Yes, and I think the most important thing is that this is an act of collaboration between healthcare providers, different healthcare providers, between us and the families, other sectors, education, even media, as Ms. Camila mentioned, vocational services. So this just shows how each of us has at least some role. Change might be difficult, but if perhaps any of us just take one step, inshallah, we can reach a better future. This I'm kind of getting emotional. I cannot imagine honestly reaching. I know I've said reaching the final part of this series, but I want to say, you might have heard me say this before, this is just the beginning. In general, we're hoping to do more events in the future, inshallah, but also in terms of each and every one of us, we're really hoping that what we've all gained throughout this series, that all of us can use it to become better in general. I just want to thank everyone, whether you've been with us only today for a couple of sessions or all of the series. We hope that you've gained knowledge and you've learned about this, learned about other people and other basically services and opportunities within this community.
Thank you. Thank you for the opportunity for participating in such an event.
Thank you, Dr.
Thank you so
Shak
much.
and Dr. Zakaria. It was a pleasure. Thank
Dr.
you,
Zach,
everybody.
perhaps you would like to say something.
Oh, yeah, so again, I'd just like to reiterate what's been said. You know, this webinar series wouldn't have been possible without the collaboration of the stakeholders across Qatar. So we really appreciate your time and sharing your insights and your experiences with us. And as Dr. Shahad mentioned, you know, we've received a lot of feedback from from the participants, and we're hoping to use that feedback to inform future activities to shed further light on this very important topic. We will leave you now. We're out of time, unfortunately, but we very much look forward to welcoming you back to future CPD activities within Qatar University. Thank you so much, everybody.
Thank you.
Thank you all.